Hello, my name is Emily Freeman, and I'm a student with Indiana State University in their RN to BSN program. The topic I'm going to cover today for my community health nursing project is clinical burnout. The population at risk for this topic is going to be nurses that are dealing with the stresses of their profession, which can lead to clinical burnout. Learning objectives that I've covered in this presentation. Upon the completion of this presentation, the learner will be able to define clinical burnout, name the 3 dimensions that are characterized by clinical burnout, name at least 3 symptoms of clinical burnout, understand the causes of clinical burnout, and understand why clinical burnout can be a problem for our field of nursing and for patient population, and know how to manage clinical burnout and where to go for resources. Please stop at this point of the presentation and take the pretest in order to assess your knowledge on clinical burnout. The pretest can be accessed by clicking on the link that is provided at the beginning of this YouTube video. What is clinical burnout? The World Health Organization defines clinical burnout as a syndrome that results from poorly managed and constant work-related stress. There are 3 dimensions that characterize clinical burnout: feelings of exhaustion, mentally distancing oneself from the job or feeling like pessimistic in relation to the job, and a reduction in professional efficacy. There are many areas of focus in relation to clinical burnout. For the purpose of this presentation, we will focus on the symptoms that are related to clinical burnout, the causes of clinical burnout, why clinical burnout is a problem for both nurses and their patients, some statistics related to clinical burnout, and how clinical burnout can be managed. Symptoms related to clinical burnout include feelings of exhaustion, having a lack in energy, maybe due to stress or due to sleep disorders, a reduction in job performance, which can come from feeling fatigued or feeling stressed about your job, difficulty concentrating, definitely happens when we don't get enough sleep, difficulty with your memory, poor decision making, and a reduction in initiative and creativity. We may not feel as excited about our job, so we don't run up there to give new ideas, and we just lack the initiative. What are some causes of clinical burnout? The attitude that a nurse has towards their job can be a contributing factor in their performance. However, there are some personality traits that are found to be contributors towards clinical burnout. Being a perfectionist, things have to be perfect or we just cannot move forward. A low expectation of competency or having a negative outlook or an I can't do it attitude, not believing in oneself. A high need for harmony amongst fellow staff members or high expectations of teamwork. Maybe an attitude that we expect everybody else to perform exactly how we perform, or that just stresses us out. And a fear of being controlled or micromanaged. What are the consequences of clinical burnout? It contributes to the ever-growing nursing shortage, which is a worldwide problem. It contributes towards nurses using more sick days, contributing to staffing shortages. This directly impacts patient care when there's not enough staffing in order to provide safe and effective care. It contributes to higher turnover rates, nurses leaving their job in search of a job that gives them better fulfillment. It lowers the quality of life of the nurse due to mental stress and sleep disturbances. Burnout can contribute to a higher incidence in medical errors, as the nurse may not be as alert due to fatigue and stress. They may make more medication errors, or the patient may not get the attention that they need, contributing to more infections and more wounds and even falls. Burnout also leads to a patient feeling dissatisfied with the care that they've received at that facility. Some statistics related to clinical burnout I have included here. 43% of RNs working in a hospital setting report feeling symptoms of emotional exhaustion. This may be due to stress, there may be bullying happening there, they may not have great management, there may not be enough staffing for them to adequately care for their patient population. 33% of RNs who are providing direct care in a hospital setting report feeling burned out. You know, a lot of these are, there's a lot of this that can happen in the emergency room where the nurse sees a lot of really bad injuries, death, and sicknesses, and there may not be enough staff there as well, which can contribute to burnout. 50% of RNs have thought about leaving the profession due to feeling burned out. And I'm not just saying they want to leave their job, they don't want to be nurses anymore. And I've said already, we already have a nursing shortage. We have a shortage of educators to turn out more nurses. So this is a problem when we have nurses leaving the profession. A patient that hasn't experienced a nurse who is burned out are 2% less likely to recommend that hospital to another patient for every 10% at that facility of the nurses who report that they are burned out or dissatisfied with that specific hospital. How can clinical burnout be managed? Our patient population deserves the very best of care. This means that the nurse must care for themselves first. Self-care must be at the top of the list for change where burnout is concerned. We need to recognize the symptoms if we're feeling this way, and we need to have the drive to do something about it. So the nurse should ensure that they have their own sense of well-being, because a nurse cannot pour from an empty cup. This means maintaining a healthy lifestyle of good nutrition, exercise, and adequate sleep, and perhaps even mindfulness, being aware that you have an issue and a drive to do something about it. Learn to say no. No, I need to take my bathroom break. No, I need to take my lunch break. No, I need to finish this task before I can move on to another, and then I'd be happy to help. And you also need to learn to ask for help where help is needed. Don't try to go at it alone. If you need help, please reach out and let your coworkers or your manager know that you're swamped and you need help with your job. It doesn't make you weak. All of us need help at some point. Realign yourself with the reason that you became a nurse in the first place. This is your why. This was a calling that you felt that you needed to join the profession of nursing in order to be a caregiver. Sometimes you might need to realign yourself with that. Learn the signs of nursing burnout and seek assistance where assistance is needed. There are plenty of resources that are out there. There are hotlines that you can call. You can definitely reach out to your manager, because most facilities have an employee assistance program that can help you deal with feelings of stress. Please stop here and take the post-test in order to assess your knowledge on clinical burnout. The post-test can be accessed by clicking on the link provided at the beginning of this YouTube video. I provided a flyer here with some links to great information with the World Health Organization and the CDC's websites. They provide information on the symptoms of clinical burnout, an explanation of clinical burnout and what the causes are, tips on coping, and resources to seek when in need of assistance. Remember, nurses cannot pour from an empty cup. So avoid clinical burnout by caring for yourself first. Be the change that you wish to see in the world. Change yourself so that you can take better care of your patient.